I'm joined here on this beautiful day in Rhode Island with Lieutenant Governor Matos and members of my cabinet, and I thank each and every one of them for their work in preparing for today's presentation. Back in March, when I became governor, Rhode Island was a different place than it is today. Being one of the most infected states in the country on a per capita basis, we were a big, bright, red hot spot in the nation's on the COVID map. Harvard University had just given Rhode Island an F. Ranking Rhode Island was in the bottom 10 states nationwide for coronavirus deaths, in the bottom 10 vaccine doses administered, in the bottom 10 for the use of available doses, and the bottom 10 for the speed of getting shots into arms. Together, we significantly turned that around. We immediately got to work partnering with municipalities to get more shots in the arms of Rhode Islanders, prioritizing teachers and childhood staff, child care staff, so that we could work to get schools back open and kids back in the classrooms. I just visited Westerly schools as well as Smithfield schools this morning to get an update on what that looks like, and it looks good. And now today, because of all the work that we've done together, Rhode Island has one of the highest vaccination rates in the nation, with over 88% of our adult population vaccinated with one shot in the arm, and over 80% of the adult population fully vaccinated. And Rhode Island has the second lowest coronavirus test positivity among the 50 states over the last 7 days, and we're 47th in the current number of COVID hospitalizations and 46 for the deaths. One of the lowest death rates in the country, and we've been able to have that all through the Delta variant. Rhode Island aggressive vaccination and public health responses have positioned Rhode Island as a leader in the country as it enters the post-COVID economic recovery. The recovery has been strong for Rhode Island businesses and workers. In fact, the state reported a 7.5% increase in real gross domestic product in the second quarter of 2021, exceeding the growth rates of the United States and the New England region. Rhode Island has also ranked among the top 10 states nationally and led the Northeast and Moody's Back to Normal Economic Recovery Index for the last several months. As of October 1st, Rhode Island ranked 4th in the nation and 1st in the region. While Rhode Island is leading economic reopening, as I said before, we can't take our foot off the gas and allow other states to catch up with us. Rhode Island is the only state in the Northeast that has not spent $1 of its American Rescue Plan State Fiscal Recovery Fund. The $1.1 billion received from the Biden administration. I believe that we must begin using a portion of these funds in the short term to invest in our small businesses, in Rhode Island families, their child care needs, and their housing needs. That's why today I've filed a supplemental budget amendment with the General Assembly that would allocate 10% of the American Rescue Plan state fiscal recovery funds to make a down payment, a needed down payment on Rhode Island's economic comeback. Our down payment proposal titled Rhode Island Rebounds, would provide an immediate investment into Rhode Island's families, workers, and small businesses. I want to thank both Speaker Sakachi and President Ruggiero for meeting with me regularly over the last 6 months to discuss, among other things, my administration's plans for both short and long-term investment strategies of these funds. The budget amendment includes many of the priorities that we all agreed were important, and my team, and I appreciate the feedback and insight they've provided throughout the process of finalizing this proposal. I'm going to walk through some of the top lines and details of the budget submission. Then I'll turn it over to the Lieutenant Governor to provide some remarks, and then we will open up the questions for our cabinet members. Joe Cadiga, our budget officer, along with members of my cabinet, will also be around after the Q&A in case you need any additional questions and need any clarifications. We start with small businesses and impacted industries. Rhode Island's small businesses have been hit hard by the COVID-19 pandemic, and while both the federal and state government have provided a range of small business resources and supports, there are clear gaps and ongoing needs, especially as variants pose continued challenges to consumer confidence. My budget amendment proposes investing $32 million to support small businesses and impacted industries. This includes $12.5 million for direct grants to provide immediate financial support to small businesses affected by the pandemic, with the aim of delivering 20% of these funds directly to minority-owned businesses. $10.5 million for technical assistance to support businesses in capacity building and upgrading technical infrastructure, and $7.5 million for increasing outdoor activities, maintaining clean and safe business districts, and for public health improvements like HEPA filters and ventilation, and $1.5 million for outreach, reporting, and compliance. Additionally, my budget amendment invests $13 million in support the recovery of travel, tourism, and the events industry. Commerce Secretary Pryor is here, and he can provide additional details on the breakdown of the travel, tourism, and events industry's proposals, as well as answer questions on our small business initiatives. We also propose to invest in our children, families, and social supports, $38.5 million. High-quality, safe childcare is essential to the well-being of children and their families. Unfortunately, the childcare industry has been hit hard by the pandemic and is struggling to attract and retain workers due to low wages driven by a long-standing lack of public investment. Childcare educators and providers continue to do the heroic work of supporting young children and ensuring families can re-engage with the economy. And the staffing crisis threatens childcare's ability to provide enough capacity for every family needing a childcare seat. Our down payment plan calls on investing $13 million to provide retention bonuses to supplement baseline wages for over 8,200 childcare workers, as well as assistance to new family childcare providers entering a market that needs expanded capacity. We heard that from our childcare providers yesterday when we met in Warwick. Additionally, our down payment proposals invest $12.5 million in federal funds for the purpose of providing workforce stabilization payments to the direct care staff of the service provider organizations contracted by the Department of Children, Youth, and Families. As a result of the public health emergency, many children could not access regular preventative primary care. This has led to delays in routine vaccinations for children, developmental screenings, lead screenings, and other vital preventative care that ensures healthy development. Data from the last year shows racial disparities in access to pediatric care, which must be addressed. Our budget amendment provides $7.5 million in federal funds for the purpose of this pediatric relief programming. The funds will assist pediatric primary care practices to retain staff, implement extended hours, conduct enhanced research and outreach, and bring additional family supports, such as social workers, to address the crisis and ensure all families are caught up on their care. Early intervention provides essential childhood development services that support healthy outcomes for our children. Due to the pandemic, early intervention providers face significant losses due to the current rates, and today are struggling to hire and retain the staff needed to provide services to all children needing early intervention programs. As of today, 4 of 9 early intervention providers are closed to referrals. Our budget amendment invests $5.5 million in federal funds for the purpose of assisting early intervention providers to mitigate the economic impact of the pandemic, recruit and retain workers, avoid further closures, and provide continued service to children with developmental needs. I have members of my cabinet here from across the Executive Office of Health and Human Services, including Director Coyne, Director Schaefer, and Anna Novus, who is the Chief Staff to the Secretary of Jones, who couldn't join us today. She's dropping off a daughter at college, family matters. They will be happy to answer any of your questions regarding these issues. Third, investing in affordable housing and housing stability supports. We propose to invest at this moment $29 million. As we all know, Rhode Island is experiencing a housing crisis, and while the state has taken major steps to address it in this past legislative session, more needs to be done, and it needs to be done now. A down payment plan would invest $15.1 million to incentivize the development of affordable housing. The investment would be targeted at assisting individuals with an income below 80% of the area median income. Further, our plan would invest $12.2 million for a property acquisition grant program. The funds would provide for a grant program that would finance the acquisition of properties for redevelopment as affordable and supportive housing. This initiative intends to increase the supply of quality, affordable, and supportive housing while strengthening our communities. Finally, I'm proposing to invest $1.6 million in stability services and developing a real plan to provide affordable broadband internet for every Rhode Island family. Commerce Secretary Carol Ventura and from the Rhode Island Housing and Kim and Hearn from my staff are here to answer any questions related to our housing proposal. I'll close by saying this. We need to make these investments now. The state of Rhode Island has made too much progress over the last 7 months not to invest these dollars. But this is just a down payment on our economic recovery. There's much more we should do over the long term in areas such as infrastructure, climate change, public health, education, small business, and housing. And I expect that we'll be able to debate how the balance of the dollars, the 90% of the dollars, would be spent in the long term to address these issues. Making investments in short term and long term can complement each other to bolster Rhode Island's economic recovery. And I look forward to working with my partners in the General Assembly so we can begin allocating funding soon as to safeguard our recovery and to ensure a more resilient, equitable, and prosperous state for all, and also making sure that we keep people safe, healthy, economically strong, and our children and our students back in the classroom